Hello everybody, Dr. Kritzer back with you for Contact Tracer Training. This is Unit 2, Part 2, and we're just going to talk a little bit about risk factors for severe disease, specifically for people getting exposed to and contacting COVID-19. So, the first group that's obviously at risk are elderly people. And the more elderly over 65 uh, combined with pre-existing conditions, the more at risk people are. So that's why it's so important that we talk about protecting the elderly in our community. That has implications for people who are less at risk, for kids and young adults, because if you go out there and are exposed and then come home to people or visit people in your family that are elderly, the last thing you want to do is be responsible for their illness or, in worst case, death. It's very important that we protect our elderly, and that obviously if we visit anybody, it's better to visit them outdoors, obviously to wear masks, stay socially distant. I know that's difficult for family members, but that's very important. It's also one of the reasons why we can't visit people in nursing homes. We have to find creative ways to Zoom with them or see them through the window. It's a sad commentary, but that we are doing that to protect people. Another group that's obviously at risk are people who are obese. And this wouldn't just be for elderly people who are obese. Young people who have extreme obesity are obviously at risk as well. And there are some young people that become very ill with COVID. Young people are less at risk, but they are not immune. Some get very ill and some may die. And there are situations where we're noticing athletes developing cardiac muscle issues that need to be seen and dealt with before they can compete in athletics. So it's very important that we consider that not just, this doesn't just affect old people. And obviously, there are medical conditions that put people at risk. Diabetes, for one thing. People with diabetes are more at risk for getting complications from COVID. People with high blood pressure are more at risk from getting complications from COVID. And another issue might be that people requiring medications need services so they can get those medications so not to have to go out there and be exposed to COVID. Any kind of lung disease puts you at extreme risk for COVID. COPD, emphysema, and asthma can really complicate the issues one experiences with COVID. People with heart disease are at risk. People with liver disease and kidney disease need to be sheltered from people who have been exposed to the coronavirus. And then, in general, people with weak immune systems and weakened immune systems are certainly more at risk for complications due to COVID. And it must be said that with the health problems that exist in minority communities, in Native American communities, with situations that exist in prisons, situations that exist in nursing homes, all of these people are extremely at risk from community spread of COVID. And those situations need to be nipped in the bud as soon as possible. This disease can really affect how people can intake oxygen. Many require, in severe cases, require a ventilator, And we are getting better at having people recover once they get on a ventilator. But early in this pandemic, many people who got on ventilators died. If the lungs can't recover, if people can't breathe on their own, this caused increased risks for heart attack, kidney failure, strokes, clotting disorders, and again, we're getting better at dealing with people. We're getting better with therapeutics, but there are long-term implications as well as beside death that can affect people who are more at risk. People don't have equal access to care, to health care. We don't all have good medical plans. We don't all have access to testing still. We don't have access to all the good therapeutics. Not everybody has access to them. While death is rare among young people, it happens. Again, the older you are, the more at risk you are. Although we are, again, getting better at treating people with severe COVID. But there, again, in summary, there is no specific treatment right now to cure COVID. People are experimenting with antibodies, vaccines are being developed, therapeutics are being developed, but right now they're not ready, and it could be months before the general population has access to them. So again, it's very important to prevent community spread, to protect people at risk in our communities until we get to the point where we are better at vaccinate. We have vaccinations for those who want them and therapeutics for those who need them. I'm Dr. Kritzer. I will be back with you again for Unit 2, Part 3. Bye.